Does pelvic drop equal lateral hip weakness? If your hips drop when you run, does it mean you have weak lateral hip muscles? Also known as contralateral pelvic drop or increased hip adduction, there has been some research linking this particular trait to running injury. Excessive pelvic drop is also seen in conjunction with a lateral trunk shift and/or excessive hip adduction. The potential implications of this increased pelvic drop and increased hip adduction may include lateral hip stress, ischiofemoral impingement, increased knee load, peak external adduction moment, and peak ankle eversion velocity were also significantly greater in runners who sustained an injury, and patellofemoral pain. The increased pelvic drop is viewed from the frontal view during midstance. You can measure the angle by drawing a line through the PSIS and measuring the angle formed between this and a line parallel to the floor. Normal range here is less than 5 degrees. This is often associated with an increase in hip adduction and hip internal rotation, which can also be seen during midstance, looking for the knee window, which is absent in this runner here. And you can also watch the popliteal fossa for any internal rotation. So is there a relationship between hip strength and pelvic drop? Earlier research had initially suggested a relationship between the two, but a recent study by Zatoni et al. Found no association with dynamic knee valgus to core endurance or posterior lateral hip strength. This would also explain why strengthening the hip does not change hip drop or knee adduction, which has been found in a number of studies. So for those displaying pelvic drop, knee valgus or hip adduction and it needing to be changed, running gait retraining is likely the best option here. With gait retraining, there are a number of different cues that can be used to create this change, including cueing a level pelvis, either telling the runner verbally or using a video or mirror feedback as a visual stimulus, cueing the knees apart, or increasing cadence. So to reiterate, just because you possess pelvic unleveling during running, it does not mean that there is hip adduction weakness, but also to the contrary, the absence of pelvic hip drop does not mean there is sufficient strength.